What's the number one reason doctors choose to practice medicine in a rural community? Variety. Doctors often refer to it as working to the full scope of practice. Scope of practice refers to the procedures that a doctor is allowed to perform.
Now we're ready for the day.
Here's what a typical day looks like for Dr. Jonathan Somerville, a rural family physician in Sundre.
PSA was okay, liver enzymes.
He starts by checking patient lab results that came in overnight, then walks over to the hospital next door to make rounds of his patients there. Today, that includes a patient whose condition is worsening. He arranges for an ambulance to transport her to an urban hospital with a higher level of care.
Thank you.
Next, he returns to his medical clinic to see patients for the rest of the day. Why does he enjoy practicing in a small town so much?
I think it's the reward that you see of being able to take care of people over a long period of time and really get to know not just them as a patient, but how they live in their community, who their family members are, and just see them get better.
Squat down, can you do that sort of motion?
Dr. Somerville took extra training in treating young patients with mental health challenges. Today, that area of medicine has become his specialty. He also visits patients in long-term care homes and covers 6 to 8 shifts a month in emergency. Once, he helped save the life of a hunter who had been mauled by a grizzly bear.
Those are some of the defining moments of working out here, the stories that you never forget.
Dr. Deanna Funk practices in Spirit River. She loves working to full scope of practice.
Medicine rurally, I think, is a lot more interesting. You see a lot more variety as a family doctor in particular, because most of us work emerge.
Dr. Funk loves the team she works with.
The relationship between doctors is one of the big reasons I chose to come here. We all work very collaboratively. We all have each other's backs.
Dr. Saurabh Parmar grew up in a city with over 1 million people. Today, he practices in Beaverlodge, population 2,500. He sees patients both at the hospital and the medical clinic.
I really enjoy the full scope of practice that I get. I don't think I would have gotten this experience as a urban or city doctor.
Dr. Parmar loves stitching people back together. Suturing, it's called. Working in emergency, he gets plenty of opportunities to hone his suturing skills.
15-year-old come in, they were chopping some wood and they ended up getting their foot in the way of the axe. Just on Monday, I had a guy who was using a mandolin and he thought he accidentally chopped off the tip of his finger. So
he finds treating serious emergencies the most satisfying.
People come in with strokes or heart attacks, and when you are able to make life-saving interventions in those situations, it's really a rewarding feeling.
Dr. Jaco Hoffman is a rural family physician in Olds. This afternoon, he's seeing 6 moms or moms-to-be for their regular checkup. Dr. Hoffman is trained in delivering babies, or obstetrics as it's called. Later that afternoon, he and his operating room team are performing a scheduled C-section at the Olds Hospital. All is going well, and it's not long before baby Harper is brought into the world. Dr. Hoffman is also trained in giving drugs to relieve pain for patients undergoing surgery. The morning after the C-section, he is back at the hospital as an anesthetist for this shoulder surgery and other operations throughout the day.
Tell us your full name.
Tyler Charles Casey.
What surgery are we going to do for you today?
My right knee.
For this knee surgery, Dr. Hoffman is teaching a doctor in training how to do a spinal anesthetic to numb the patient's leg. Dr. Hoffman also sees patients in his medical clinic in Didsbury and volunteers in his community.
Everything that we're looking for.
At this party program event for high school students, a mock accident has been created. The goal is to show students the dangers of drinking and driving. Dr. Hoffman plays the part of an emergency department physician, trying to save the life of someone injured in the crash.
Rural medicine has got so many rewards, right? Not only just for your journey as a practitioner or professional, but you really make friends and you have relationships that will stay with you for the rest of your life.
As you can see, the opportunities for rural family physicians are exciting and abundant. Variety truly is the spice of life.